Harnessing and Showcasing Innovation in Centre-Based Daycare, presented by Susan Johnson and Jackie Tibbetts.
Good morning, my name's Susan Johnson, and together with a colleague Jackie Tibbetts we developed a workshop called Harnessing and Showcasing Innovation in Centre-Based Daycare, and we'd like to share with you some of the outcomes from that workshop. The objectives for the workshop were to promote innovation in centre-based daycare, to reinforce client-focused care and choice, to encourage flexibility and decision-making by clients who are attending centre-based daycare, and to identify opportunities to implement and sustain the wellness approach within those facilities. We also wanted to expand the range of options available within centre-based daycare and to encourage volunteers, staff and organisations to become more creative and innovative. The workshop was also an opportunity for service providers to showcase their innovation work within centre-based daycare. We at Community West are well aware of some of the great things that's happening out there in the community, but there are very few opportunities for service providers to showcase this type of innovative work. So, what was the workshop based on? Well, originally we looked at it in terms of dependency versus the wellness approach. A dependency model of care is really the traditional way of providing home and community care services. From this model, clients were bussed into centre-based daycare. Everyone was offered a range of activities, usually in quite large groups, and so we had things like bowls, bingo, craft, all at set times each day, and so all of the group activities were undertaken as groups, and that required often less staff, so it was quite cost effective for home and community care programmes. Unfortunately, however, it did not take into account individual preferences, what each client actually wanted to get out of their day, and what made their lives meaningful and purposeful within that centre-based daycare facility. So what we were trying to do was encourage centre-based daycare to become more wellness focused. Well, the wellness approach is about recognising people's skills and abilities and determining what it is that they can do within a centre-based daycare that would actually promote their independence, autonomy and quality of life. In addition, the wellness approach tries to connect people to their community, and this is particularly true for people who are relatively socially isolated. Within centre-based daycare, they have that opportunity to connect with peers and to undertake tasks, routines, activities and pursuits that they may not have the opportunity to do at home. The wellness approach is also about maintaining individual autonomy and really supporting people to get out of their lives whatever it is that gives their lives meaning and purpose, to expand their health, their well-being and their quality of life. The wellness approach is about the whole of person. Whole of person takes into account their psychological health and well-being, their health, their physical health, their social connections, and the practical support that they might need to undertake acts of daily living and to stay living in their own homes within the community. But it's actually more than that. It's about what is it that's intrinsic to each individual's life? What is it that gives their life meaning and purpose? And how can centre-based daycare actually assist that? That may be something like joining a music group. It may be going out on an outing. It may be reading and discussion. And for some people it might be the more traditional things like crafts, bowls and bingo. So really these workshops were about supporting organisations to think outside the box, to think about what can we actually implement within our centre-based daycare that will provide a full range of options for individuals so that they have real and meaningful choice and that they're not just doing busy work, they're coming to centre-based daycare to actually enjoy what they're doing.
Thank you, Susan. And following in from the whole-of-person approach, what's really important with that are clients' rights. These are the rights of all individuals. The rights that we expect as human beings are the same rights that our centre-based daycare clients are entitled to. And some of these rights may be from making decisions to saying no, to being informed, and to be treated with dignity and respect. And when we're looking at clients' rights, it is essential that the client is at the centre of decision making regarding their support. Centres have a responsibility to support and inform clients, carers and families to support the client to make informed decisions. Throughout the workshops there was a positive energy when participants were talking about how their centre respects and upholds clients' rights. But what also became apparent and came through these conversations was the challenges faced by participants and their centres, and that when they're continually trying to uphold clients' rights, that there were two main challenges being faced. The first challenge was resourcing individual choice within a group setting, whether it was fiscal constraints, staffing, buildings or vehicle availability. And the second biggest challenge faced was respecting a client's choice to take risk within the CBDC or the parent organisation's OSH framework. And two of the examples that were given were clients serving their own food and clients coming and going from the centre as they chose. And this was regardless of the client's ability or capacity. And over the course of the workshops, those two topics alone divided the room every time. What was apparent though is that as centre-based daycares continue to adapt to a changing environment, that the management, staff, volunteers and clients are embracing innovation to triumph over these challenges. But as we all know, not everyone embraces innovation, and some stakeholders actually may be fairly resistant to it. Participants shared with us the challenges that they face within the centres. There is a perceived lack of time and resources. So sometimes staff and volunteers can feel too busy in what they're doing and that there might just be too much paperwork involved. There sometimes can be a lack of commitment. So when we're looking at innovation and creativity, it's really important to have management buy-in. Sometimes it can be the existing processes within the centre-based daycare. So what might seem like a good idea for a support worker or volunteer, it might actually just be too hard to get it through the organisation's processes. There can also be the organisational culture. So innovation may not be supported or welcomed. And sometimes as well within some of our ethnic communities, doing for an older person is a sign of respect. There can also be resistance to change. So sometimes our longer term workers or volunteers may not see a need to change. And sometimes you might hear, this is how it's always been done and it's always worked. There can also be some challenges regarding knowledge, skills and abilities. And as you are aware, and it's important to remember, that ideas do not always have to come from management. Innovation themselves can come from clients, carers, family, volunteers, or any staff member. There can also be an ideas drought, where sometimes people feel that they're too busy to have time to think. They're too busy to think of new ideas and to be innovative. And sometimes during these processes as well, we can hear people say, no, yes, but. By identifying the challenges, participants across all the workshops were able to identify and share strategies to overcome them, and they shared their journeys of being creative. During the workshop we explored 7 themes and shared innovative ideas. We looked at improving mobility, and some of the things that we looked at here were fun exercise programs and taking regular short walks and muscle strength training. And what a number of participants shared was actually trying to keep exercise and activities similar to what someone would do at home. One manager also shared how using Tai Chi helped his clients outside of the centre. There was an example where a couple had gone home and then they ended up facing a medical crisis between them. And what they did was use the breathing techniques learnt during the Tai Chi lessons to help them face and deal with their medical emergency. We explored improving nutrition, and some of the examples that were provided from participants was coordinating chronic disease self-management workshops, microwave cooking courses for one, and growing fruits and vegetables. And what really came through here and what I was really excited to learn was the impact this was having on clients outside of the centre. There are a lot of stories of clients being reunited with their love of food and cooking. We also explored reducing social isolation, providing fun activities and increasing mental stimulation. Some of the examples that were provided here were clients supporting social causes, such as sponsoring a sun bear. And what was the general theme here was that clients themselves did their research and they chose which causes they wanted to support. Centres are partnering with local sporting clubs for lessons and sometimes a game. And one centre in particular spoke about a very successful partnership where they've partnered with a local football club. The football club sends younger members down and they do some modified skills training with the clients. At the end of the sessions, the clients are able to take a tour of the football club rooms, followed by a game. So successful has this been, the football game has become an annual event. And not only is it building trust and teamwork between the centre staff, volunteers and clients, some of the clients now volunteer at the football club. We also looked at improving memory and reconnecting clients with their community. There were discussion groups and guest speakers. There was examples given of supporting clients to access speakers and information sessions in the community, whether it be at libraries or joining other community groups. There was a use of puzzles and memory challenges, and whether this be electronic or not, that was the choice for the client. Another example as well was doing public drama performances with clients, and one centre shared their story where they've actually been invited to perform at their local festival, where the clients perform but also do all the behind the scenes work. Throughout all the workshops, participants shared 3 key elements that they said were essential to ensure successful innovation. The first one was that the client remains central to the support. Secondly, that it's important for staff and volunteers to be flexible, listen and communicate well. And thirdly and finally, that staff and volunteers get to know the client, their likes, dislikes and goals.
From the creativity and innovation activities that Jackie has just spoken about, we received different new and innovative ways of supporting individuals within a centre-based daycare group setting. That we felt was absolutely phenomenal, and since that workshop we have actually built on those. So there is now a range of opportunities for centre-based daycare to get really innovative and to provide real and meaningful choices. But one of the challenges identified by service providers was, yes, we can have a whole range of choices, but how do we actually motivate clients to try something new and something different? Change is difficult for most people, and as people get older and are attending centre-based daycare, they have gone through tremendous changes and struggles in their lives. So how do we actually help staff to motivate these clients? We provided a range of motivational tools, and the most popular of those was a tool called DARNCAT. DARNCAT is an acronym for Desire, Ability, Reason and Need, followed by Commitment, Action and Taking Steps. Now, DARNCAT is something that is a very, very useful tool, but often we try to set goals or we try to motivate people to make change in their lives. But all we do is get the desire, the ability, the reason and need. And I'm sure if you're like me, you have made on New Year's Eve a decision that this year I'm going to lose weight. This year I'm going to get fitter. But all too often that never happens because life takes over and we just forget about it. The CAT part of DARNCAT is about taking people to that next step. It's getting them committed. It's getting them to actually put in an action plan and to measure the steps, even just those small baby steps, to measure them, celebrate them, and that's what motivates people to move forward. So from that, we also provided other motivational tools such as motivational interviewing, setting up change management programs for individuals, and a raft of other tools for service providers and their staff to use with their clients. What then did we find was the outcome of the Wellness in Action and Centre-Based Daycare as found in these workshops? Well, throughout it in our evaluation forms, they said clients are happier and healthier and are more involved in centre-based daycare. They have said that clients have a real say in the support that they are provided and that they are enabled to make more choices. Staff have greater satisfaction and are more highly skilled and trained, and staff are now thinking and acting more laterally and more creatively. Organisations are making a positive difference in clients' lives and are meeting their quality requirements. So, just in summary, the harnessing and showcasing wellness in action in centre-based daycare was a really positive outcome for many organisations and for us at Community West. But most importantly, we hope and are assured that it will make better client outcomes within centre-based daycare for the people we're trying to support.